Welcome to One on One with Aunty Philip. This is a continuation of the series with the Lanka Alzheimer's Foundation. We have with us Professor Shehan Williams. He is the president of the Lanka Alzheimer's Foundation, and he's in the Department of Psychiatry at the University of Kelaniya. And one of his key research topics is on dementia. Am I right?
Yes.
All right. So please tell us a little bit about this disease of Alzheimer's and what we should know about it.
Right. So dementia is a global health priority. Dementia mostly affects older people. But in general, in Sri Lanka, there is very little knowledge about this condition or its effects. Lots of us think that forgetting or losing your memory or becoming a little cuckoo, as they call it, is part of normal aging. This is certainly not true.
Well, how could we prevent Alzheimer's or dementia in our lifestyle? In our 20s, 30s, and 40s, how could we, have a lifestyle that would be preventative?
Yeah. So, Auntie, as I said, so dementia is an important problem. It's a disease process that affects many older people, but it's not necessarily a normal part of aging. It is a illness as we see it, and it affects a lot of people. Therefore, your question is very pertinent as to how we prevent this disease and how do we manage it once a person gets this disease. So as you see, sometimes we keep using these two words, Alzheimer's disease and dementia.
Yes.
Now I need to sort of clarify that a little bit. So the predominant cause of dementia is Alzheimer's disease. There are other causes, some of which may be treatable, but Alzheimer's disease is what affects most of the people who have dementia, particularly in older years. And this disease so far has no cure and is no respecter of persons. Any of us could be affected by this condition when we age. And given the life expectancy of our country now, we will live well past 75 or even 80 years. And therefore, as you get older, the chance of getting this disease is much higher. So there are, at present, only a few important things that we can do to prevent this disease. And one of the key factors that we need to focus on is a healthy lifestyle. It's being active both physically as well as mentally at every stage of our lives, from childhood to middle age to later lives. And even if I were to develop dementia, I could reduce its progression by keeping myself active and alert and using my brain and my mind as much as possible.
So, I understand there are about 200,000 patients of dementia in Sri Lanka. And if a caregiver or a family member detects signs that the person may be losing his or her memory and comes and does a memory screening test from the very initial stages, do you see the deterioration much slower? And does it help to address the issue from the very beginning?
Yes, I certainly think so. So many people in Sri Lanka do not recognize dementia early. In so many families, people think that when a person starts showing signs of dementia early, that it's something that can be ignored, and when they start repeating things or asking the same question over and over again, or even misplacing things and sometimes accusing somebody or a family member of having stolen them, without realizing that this person may have dementia, they start an argument with this person. There is a lot of family conflict and a lot of issues around dementia, and it affects the whole family. So the earlier we identify it, the more earlier we are able to deal with this.
Right.
And I think in Sri Lanka, all doctors are now well aware of dementia, and it's very important that when the early signs of any memory impairment or other judgment issues come out, that they need to seek the help of a doctor who can direct them to a proper assessment, including a memory assessment, and then decide how best to help the family and the person to optimize the quality of life of the person with this dementia.
So you spoke of physical activity, and does that relate directly to memorable walk?
Of course, thank you for asking that, Auntie. So this is the key concept we want to bring forward through this memorable walk. So one is obviously raising awareness on dementia, and as I said, for people to be more aware of it and identify this early and also even prevent this disorder, but also start the right things, the right steps from the beginning. Every step is a memorable one, which may eventually help me to hold on to my memory even in my later years and prevent dementia robbing me of my quality of life.
So great. So memorable walk is to raise awareness of dementia to the rest of Sri Lanka, and I hope it will happen.
Hope so too.
Could you please tell us, how do we make the societies at large dementia knowing and dementia friendly?
Exactly. So that's another important area. See, dementia is a hidden epidemic. We are very queued up about corona or dengue, but how much are we knowledgeable about dementia? And how many of us have the right attitudes towards dementia?
Yes.
See, so a lot of people stereotype people with dementia and thereby stigmatize people. In fact, older people are vulnerable to abuse because, particularly when they have dementia, they can be exploited by various people, both financially, socially, and also emotionally and physically neglected. So all these aspects have to be understood, not just having, the understanding of dementia so that we can exploit this older person, but to apply this knowledge positively to support and help the person in a friendly manner. So communities, say younger adults can support older adults, or young seniors can support older seniors by mixing with them, interacting with them. So communities, so we have elder societies in Sri Lanka which can support other elders with dementia. So these are all concepts that we have to introduce into our wider society.
Okay. Thank you so much, Professor Williams. I'm sure everyone is so grateful for all your hard work.
Thank you.
You're watching One on One with Auntie Philip.